Hi there, my name is June Davy. Today I'm going to show you a demonstration of safe medication preparation and administration of an isotonic fluid. We're going to spike it to a 100-inch primary line. We're going to hang it as a gravity feed, and I'm going to show you the formula for doing that. So to begin with, I'm going to go ahead and review my physician's medication order. Very important that I check this for all the components that make this order safe and complete. I want to see the patient's name. I want to see their date of birth and a health card number. I want to see if there's any allergies. I want that order to show me the drug name, the dose, the time, the route of administration, the frequency. I want to see a current date and time. I want to see the doctor's signature. When I'm happy that all of those components are there, then I'm going to compare that to the medication administration record, or the MAR, to make sure that it has been transcribed completely and accurately from the doctor's order. So again, I want to see that all of those components have transcribed over the patient's name and date of birth, the health card number, their allergies, the drug name, the dose, the time, the route of administration, the frequency. I want to see that it's been checked by 2 nurses, and I want to see their master signature at the bottom, and I want to see their initials because their initials are going to be there as well. And then I'm going to put in my date and time, and I'm only going to sign this MAR after I've given that medication and finished the infusion or initiated the infusion for my patient. So after I've done those things, then I'm going to want to assess my patient's chart. I want to see the patient's medical history, their medication history, any history of allergies. Again, I'm always double checking for allergies. Then I'm going to want to review the Davis Drug Guide or whatever medication-related information booklet that I'm going to use for indications, contraindications, action, proper dilution, stability, compatibility with other IV fluids or medications being given, and of course any adverse reactions or nursing implications that I should be aware of. When I'm happy with that, before I assemble my supplies that I'm going to need, I always like to go in first and identify myself. I do some hand hygiene in front of my patient, very important. And then I'm going to identify myself to my patient and say, hi there, my name is June. I'm going to be your nurse today. Can you tell me your full name and your date of birth? And Jesse is going to tell me his name and his date of birth, and I'm going to compare that on the bracelet on Jesse's arm. Identifying your patient is core to safe nursing practice and medication administration and any skill that we're doing with our patient. We must always identify our patient first. Then I'm going to explain everything that I'm going to be doing for Jesse and give Jesse the opportunity to ask me any questions, voice any concerns. I'm going to be looking at verbal and nonverbal cues to see how Jesse is feeling about this. Then I'm going to, while I'm here, I want to check the patency of that IV site. So your agency policy is going to dictate a lot of your flushing policies and how often that's done. But I definitely want to come in, I'll have my saline flush, and I'll have an alcohol swab, and I'm going to go ahead and swab the end of that really well, and I'm going to be checking the outside and assessing for phlebitis and infiltration. That's so important. We need to know we have everything is working well there. I want to check for leaks, and then I want to check to see that it's still in the vein by my flushing and pulling back, aspirating for a flash of blood to see that it's in the vein. And then I'm going to flush however many mils of normal saline that agency policy dictates I should. So when I'm happy with all that, I'm going to come back to my station. I'm going to assemble my supplies, which I have right here, and I'm going to make sure I'm on a clean surface. It's important that all of our preparation happens on a nice clean surface. I can follow along with my MAR now. I don't need my doctor's order. So I have my normal saline 0.9% here, and I have my tubing, and we're going to talk about those things as I open them up. I also have a piece of tape here. I have the date, time, and initial on this piece of tape. And so when I initiate this tubing, it's going to be a continuous feed, so it's good for 96 hours, or according to agency policy. I'm going to label that so that the nurse coming after me will know when this tubing was initiated. It's fiscally responsible, and of course it's best practice for our patient because bacteria grows in tubes, and we want to make sure that we're changing this tubing appropriately and when we should. An intermittent infusion line is only good for 24 hours, so it's important to know those ranges. So let's get started. We've talked about all of the things that we should. We're going to be doing 3 medication checks, and we're going to be applying 10 rights to each one of those medication checks. And we have our MAR here. We're comparing and keeping everything really very much in front of us and present as we're doing these checks, okay? So I'm going to start with my solution. I'm going to go ahead and open that bag. And I'm going to check the label for the expiry date and make sure that it's still good. I'm going to check the label and make sure I actually have normal saline 0.9%. So this is my first check. The first time I pull this out of the bag or pull it out of my drawer or wherever I'm getting it from, that's my first check. And I'm actually lifting up my MAR. I want to see what I have very, very clearly in front of me, and I'm comparing that I have normal saline 0.9%, and that's exactly what my MAR says. And then I'm going through those 10 rights that I know I apply right now, and some of them don't apply until a little while later. So for example, we know we have the right patient. We just went in and identified Jesse. We know we have the right drug because our MAR and our solution tells us so. The dose we're going to work on in our calculation. I've given my patient the right education and the right to refuse. I'll evaluate and document at the end. I know the right reason. I've looked up in the Davis Drug Guide all of the pertinent information. So you can see how this works. So then I'm going to move to my tubing, and I want you to take notice of the little number that is written in the corner right here on your tubing packages. There's a number 15. That is a drop factor, and that means that there are 15 drops in every mil in this tubing. So that number we're going to actually use in our formula to finish and complete this demonstration. So I'm going to go ahead and open my tubing. And you'll see when you open up your tubing that it has a couple of paper ties that are holding it together. And those paper ties tell us to tighten all of the inline connections as soon as we open the package. And so the trick to a good prime is to go slow and to make sure you've closed the roller clamp. So as I pull off those little ties, I'm going to go ahead and close that roller clamp right away. I'm just going to lift this out so that it doesn't get tangled on me. And we're going to go through the components of our tubing. I'm just going to unravel that first. Great. So I'm going to go ahead and I'm going to close that roller clamp right away so that I don't forget. If you fail to close your roller clamp before you prime and spike and prime your bag, you'll get a very turbulent flow of fluid in your tubing, and it'll create a lot of bubbles, very difficult to get out, and generally ends up with you getting frustrated, losing a lot of time and a lot of fluid, and throwing it out and starting over. So make sure you close all of those roller clamps to start. So I'm going to show you the components quickly of the tubing. We start at the top. We have a sterile spike that is under that cap. That sterile spike is going to spike this bag when I hang it on the pole. After I pull that blue tab off, there's a sterile port under that blue tab. So it's a bit of sterile technique as well. We're making sure that nothing touches this spike under the cap and nothing touches the port once I pull that off except this sterile spike. I'm going to show you then that the next part is the chamber. This is where we count the drops, and this is the top. We're going to call this part of the tubing the top. As we follow the tubing down, we can see a back check valve that becomes important in our gravity feeds. It has a little mechanism that shuts your primary and your secondary bag at different intervals off when you need something else to run. As we move down the tubing, we see our first Y valve. This is what a primary or secondary piggyback or secondary set would attach to. We follow down, we see our roller clamp, which I instructed you to always close when you open your packaging. We follow the tubing down, we can see another little green clasp that just is floating freely. That's just another clamp that we close closer to the bottom. And as we follow this down, we see a second Y port, and that's for doing an RN or doctor IV bolus push. And then at the end we have our end that we connect to our patient's IV, and it has a sterile cap underneath. When you're priming the line, you don't need to take that little sterile end off to prime. So I'm going to go ahead right away and attach my tubing, my tape, just right below the chamber so that I won't forget to later on. So now everybody knows when this was initiated. So While I'm getting ready to prepare, I'm going to do my second medication check. I'm going to look at the MAR, I'm going to compare, I'm going to do the same thing again. I'm going to use those 10 rights and I'm going to compare it to the MAR and make sure that I have the right drug. I'm going to have the right dose when I finish my calculation. I've already talked to my patient and so on and so forth. So I'm going to go ahead and spike this bag. I'm going to hang it first with the label facing me. And then I'm going to gather up my tubing. I'm going to make sure nothing falls on the floor. You get used to doing a lot of things with your fingers at one time so that you're maintaining your sterile technique and pulling tabs off and caps off. So I'm going to come over here to my pole. And so in my non-dominant fingers, I'm going to pull that little port down and I'm going to hold on tightly to the bottom of the port where that blue tab is. And I'm going to keep my fingers there until I have the bag completely spiked. In my dominant hand, I'm going to hold the chamber in my hand, and you can see those little butterfly tabs. I've got my thumb and my index finger under them because this is going to require a bit of muscle, and that's sharp under there. You could actually stick it through the plastic port of that tubing that I'm holding and stick it into your fingers, so it takes a bit of muscle to do. So while I'm holding on to that spike, I'm going to, with my thumb and my index finger, I'm going to reach over here while I'm holding onto the port. I'm going to pull off that blue tab. And then I'm going to reach my chamber behind this non-dominant hand. I'm just going to pull that cap off while I maintain sterility of that spike. And then I'm going to come towards the port that's sterile inside, and I'm going to make sure that I put the spike directly in that port, and it's just a push and twist motion. So you're using your muscle and you're pushing and twisting that tubing on. You get that all the way down. And that's all there is to spiking that bag. Okay? Once we have it spiked, and of course I'm reminding you again that before you spike it, you should always shut that roller clamp off. Now I'm going to prime the line. And priming means that I'm going to push all of the air that is in that tubing. I think there's approximately 16 mils of air, or the tubing will hold approximately 16 mils of fluid. I'm going to push that air out of the tubing with the fluid from this bag. So for starters, we're going to reach up to the chamber, and we just give that a squeeze. You're going to let that fill about half full, and you can see the little drops that are kind of just hanging there, suspended there right now. Those are the drops we're going to count in a second with our drop factor calculation. So as I move down to hold on to the end, I'm going to prime the line. The trick here is to go slow. So just turn that roller clamp so that the roller is down towards the bottom, and you can put that in your dominant hand if you want to, and just hold the end over a receptacle that can catch a couple of drops. But I want you to watch the chamber here as it starts. I'm just going to slowly turn that roller clamp on. You can see it doesn't take much to get it rolling, and I'm just going to follow that tubing down, slow it down if it's going too fast. Tilt that Y valve, so that you can push out any air that's in there. And just go slow. The trick to a good prime is to go slow so you don't get any of that turbulent flow as it passes through the roller clamp. And just go slow. Take your time. Better to spend a little bit of extra time at this stage than to waste a whole bunch of time trying to get bubbles out. So just watch that come down the tubing, hanging on to the end, never let it fall to the floor. Sorry, I'm shaking this around too much. That come all the way down. As I get to this next Y valve, I'm just going to tilt it as the fluid comes in. Make sure I push out any air, and then I'm going to let just a drop or two come out of there. You can see that sterile cap is still on. When that's good, I'm going to shut that off. So that line is completely primed. There's not a single bubble in there. If you should encounter a bubble, there's a couple of things you can do. You can pull down on the tubing if it's close to the chamber, if the bubble is in this space, and you can give a little flick and that bubble will pop right up back into the chamber. If it's near one of the Y valves, you can swab the end and apply a syringe, and you can pull off a tiny little bit of fluid with that bubble, and the same down here near the bottom. Okay? If you go nice and slow, you shouldn't have any problem and shouldn't have to do any of those things, but those are a couple of troubleshooting tips. So now that that's safely primed, I'm just going to put that here for a second, and I'm going to bring you now to the board, and we're going to finish up our demonstration with our math. So the doctor ordered 100 mils per hour, and so that's the first part of our formula. So we're going to plug in our volume. That's our volume. That's 100 mils. And the time is per hour. So, and that's always in minutes, so that's 60 minutes. And then that's multiplied by our drop factor. And we remember from our package when we opened it that that's a 15. Sometimes it'll be a 10, sometimes it'll be a 60. 15 is a very common drop factor. Whatever it is, whatever the drop factor number is on your tubing, that's the number you use with this formula. And so I'm not going to do my long division because I know that frightens a lot of you, but you would do this calculation and you would actually get 25 drops per minute. In a second, we're going to count those drops. We're going to attach it to our patient. But if we can count 25 drops in every minute, that will infuse 100 mils of that isotonic solution every hour to Jessie. So that formula you need to know for any kind of a gravity feed. So I'm just going to move that out of the way. And so as I enter the patient's room again, I have my math done. I've done my third and final check. I would be making sure I compared the MAR to that solution again and applying every one of the rights that are pertinent at this time. And that would be my third check. So I enter the patient's room. I do some hand hygiene. I'm going to identify my patient again and make sure the patient is still okay. He should be, unless there's any kind of an issue, because we've talked about it and he's okay. So I'm going to go ahead and swab. I've flushed and I know my line is patent, so I'm going to go ahead connect. Good scrubbing. We always spend a good 15 seconds scrubbing any ends we're connecting to make sure we've removed and reduced as much of the microbial count that we can on anything that is attached to our patient to reduce the risk of infection. So I'm going to go ahead and remove that sterile clamp, or cap, sorry. And then you can see as the camera zooms in here, there's this is a positive pressure cap. I'm going to push and twist. Okay, that's all there is to that. Making sure the little clamp here is also been removed, because that's always pinched off as well. Following my tubing all the way up to make sure that I've taken off the clamp on here, because those are usually the problems that new nurses discover when they can't get their IV to run. It's usually because one of these clamps are usually shut off. And this one I'm going to hang on to, and I'm not going to open that one up yet, because I just want to talk about how you're going to proceed and do that calculation. So we said we need 25 drops in a minute. After you think you've found the appropriate amount of drops per minute, and you can be one off either way. So for 25 drops per minute, it could be 24, it could be 26. It helps to simplify it. It's difficult to count 25 drops in 1 minute and without using a lot of time. So if you split that number into 4, let's say, and you use 15-second increments, it can be a lot easier to find 6 or 7 drops in 15 seconds than it is to find 25 in a minute. So you do whatever works for you. It takes some practice, but you're going to hold your watch up right behind that chamber, and then you're going to just slowly in your dominant hand begin to turn on that clamp, and you can see those drops start to fall. And so my focus is on both of those components right now. I'm watching the drops fall, and I'm picking a spot on my watch to watch, and I'm going to go ahead and count and see if I can get that. I'm looking for about 6 drops in 15 seconds. And I've got 6 in this in 15 seconds, so now I'm going to count for a full minute and count those 25 drops in a whole minute. I do. I have 24 drops in 1 minute. So once I've initiated that and I know it's flowing at an appropriate rate and everything is okay, I'm going to go ahead and sign my MAR. I'm going to stay with my patient for a few minutes and make sure that Jessie is okay. I'm going to be checking my IV site periodically, be back and forth checking to make sure there's still fluid running. This was a 500 ml bag. If the doctor's ordered 100 mils per hour, then I guess I know I have about 5 hours of run time in this bag, and so I would want to make sure I was ready to restart another bag and had that one ready, and would do the appropriate checks as well. I'm checking to make sure that the IV site remains patent throughout my shift. Always checking to make sure my patient is feeling okay, and I would document everything that I've done, and that concludes our demonstration of an IV infusion from a gravity feed. Thank you.